Welcome to Uncloaked, a cybersecurity podcast brought to you by BlackCloak, the pioneer in digital executive protection and leader in personal cybersecurity. I'm joined today live and in person, Dr. Chris Pierson, the founder and CEO of BlackCloak. Excited to be here with you in person. It's rare that we get to do this, but it's great to get this going.
In person's always better, right? Always better. So appreciate it.
For sure. And we're talking today about the healthcare executive risk. And how that landscape has evolved, especially over recent years. Of course, we're just a little over a year removed from the tragic, violent attack and fatal attack on former United Healthcare CEO Brian Thompson, and that really, opened the eyes to a lot of people in the industry and a lot of executives across the nation as to this unique digital risk landscape. Can you tell us what we've learned so far over the last year plus?
Yeah, I mean, it's been really interesting to see what's happened. I mean, we've always known that in the risk area for board members, executives, the C-suite, the folks that are out there in front of the camera, they're out there in front of the audiences, that there is this converged risk, right? There is this physical risk that they have, and there is this cyber footprint and privacy risk that they have. And it's interesting because it's not just them, right? It's their family members, right? The husband, wife, spouse, kids, significant other for that executive. It might be the path of least resistance for how a cyber criminal or nation state wants to go in and attack the company. They attack a family member to attack the executive, to attack the home network, to go ahead and kind of ride the lightning back in onto the corporation. Or it could just be something that's financially motivated, an extortion, a ransom, but something that's going to create some type of risk to the organization, or it could be something that's just a reputational risk. But what we saw really from, we BlackCloak, our threat intelligence teams saw this happening since, right, 2019. But what we really saw from December of 2024 until present is just this massive increased risk there. And a lot of it is because of, quite honestly, the online vitriol, the negative fervor that is out there, just boiling over. But at the end of the day, right, we're talking about some of the leaders of the largest, most successful biomed, pharmaceutical, and healthcare companies. And I mean, it's been really interesting to see what happened. One of our biggest takeaways is this, notion of, we're just going to go ahead and do some data broker removal. Necessary, but totally 100% insufficient. Just absolutely not up to the challenge of really going ahead and making sure that the family is a harder target to hit. Not at all. And so that was one real big takeaway from 2025. We saw that play out in terms of the expanded services and offerings that BlackCloak is having and doing in that space. How are we actually focusing on the home? How are we focusing on things on Google and other different search engines? How are we thinking beyond just this notion of, data broker removal? And so I think what we've seen is that, look, the healthcare industry is going to be targeted. It's going to continue to be targeted. And you really have to have a product that is out there that is going to tackle both that physical risk as well as the cyber landscape and privacy and all things in between. And so a lot of change happened in 2025.
Yeah, and a lot of different needs to address all at once. As you mentioned, it's not just one aspect of it. It's really a multitude of different areas. And, before we can even really dive into the executive and their family risk itself, kind of have to understand why the industry itself is a particularly unique threat landscape as well. And part of that is just the distinct nature of the sensitive data that is held, a lot of valuable information there. And then on top of it, you touched on it, it's that public sentiment. I mean, this is a personal connection that the public has. Everybody is going to need healthcare at some point in their life. And so there is that, it hits their wallets and it hits their personal lives too.
Yeah, I mean, it's interesting. When you take a look, even going back, as you take a look at Maslow's hierarchy of needs, it's always like food, shelter, those physical security and protection, right? Making sure that you're safe and secure. And one of those things that rises to the top is, hey, how am I? Am I good, right? Your health. whether you're right in a state of good health, not good health, or doesn't matter. It's like everyone has that weighing on your mind. We go for our regular checkups, we go ahead for our regular appointments and all the rest. But your physical body, in terms of am I well, your mental health and all the rest, this is something that is uniquely personal to each individual. If you have a family unit, it's, having one person be impacted impacts you as well. And so when you think about that from a customer perspective, right, from someone actually being on the receiving end of healthcare and healthcare services, because of those stressors on the front end, and because of the impact that you're seeing to yourself or a loved one, tensions can rise, right? There's nothing more personal than, are you okay? Are you well? And so at the end of the day, this is one of the reasons why we see such a high, right, rise in customer complaints in the area of healthcare, biomedical, pharmaceutical. This is one of the reasons why we see that there are kind of hotter than normal circumstances, in kind of heated circumstances around this area. And also, when you take a look at it, just the amount of sensitive data that is there is unlike any other. You have payment information, you have identifying information, social security numbers, you have a whole bunch of other things running around this space. So it becomes a really interesting target for cyber criminals in nation states. It becomes a really, really interesting area where people take it very personally. And as a result, right, the target, or all eyes are on those 20 to 30 different leaders, right? The 10 board members, the 10 executives, the 10 executive leadership team members for that organization, for that healthcare organization. And they're all on the webpage. And they're on the webpage because what you want to do is give people peace of mind. Hey, don't worry, at our hospital, at our institution, at our pharmaceutical biomed company, we have the best of the best. Here is, Jennifer, and she has these degrees and this background and lives over here with the family unit and all the rest. And we push out that information. And what that does is it number one, increased heated circumstances, nothing more personal than your own well-being physically or mentally, and that of your family members. And then we push out all of that information, and these people they're out in the community and all the rest. And so it becomes just a very interesting point of attack. It becomes an interesting avenue for attack. And we've had just an increase in online fervor, online negative sentiment, where people want to take their complaints directly to the person in charge, directly to that individual. And so it really boiled over in 2024. But even before then, BlackCloak, as you know, we had put out special alerts in Q4 of 2022 and Q1 of 2023 on swatting and doxing of board members, of corporate executives, where literally protesters showing up at the school of the kids and getting into confrontations with the significant other of that executive. Every kid deserves to be dropped off at school and treated well, and kind of egress into the school classroom and not be confronted by protesters, and people also at their homes kind of 24/7. I mean, this is just not something that they signed up for. It's not something that we really want to have happen. And so as a result, those things just boiled over in 2024. And we're still, I know that we released some great research just a few months ago at BlackCloak. I know that we're still seeing that increased vitriol, the negative fervor out there. And quite honestly, we don't see an end to it, Dan. We just really don't.
Yeah, it's unfortunate, in the public discourse, they all want to channel that towards something. And that's why it does end up largely at the feet of leadership. And that's where, when we talk about that risk profile, you mentioned they're on the webpage, but it goes so much further beyond that too, right? I mean, their personally identifiable information is everywhere. They're also, there's media coverage. Some of them are even doing media interviews. And then some of them are working from home using devices, right? I mean, there's a lot at play here.
It is. It's interesting. When you take a look at the leadership of some of these healthcare organizations, biomed, pharmaceuticals, their personal life and their work life are just inextricably intertwined. There's no separating the individual, and for good purpose, right? They are literally living in that mission of the institution. It might be that on a Saturday they're doing a Acme Healthcare Cares fundraiser, and they're out there raising money in the community, or doing Habitat for Humanity, or doing a Cake for Kids, a charity event or something, and they're participating with the logo of their institution, they're participating with their family members there. These are all things that we absolutely want. We want in our society. We want to give back. But even then, when we're doing something on the volunteer side, we've seen confrontations, we've seen things happen. So those executives are, right, there is no personal and private really delineation line. The family members, have kind of signed up for that as well. And they really have become the face of the company. I mean, and the more successful you are there, the more that you're doing, as part of the role of the executive, of the board member, to be out there doing investor relations, out there doing community events. We just, this past year, we had about 137 data broker records removed, 137,000 data broker records removed for the executives of healthcare companies, just healthcare companies. Yeah. We have, right, in terms of representing 25% of the Fortune 100 companies out there, we have companies in every sector, but just in healthcare alone, I mean, those are the instructions and the roadmap to have somebody come in, send that information out and dox somebody or spot someone. And there have been accidental shootings in spotting events that have happened. So this is a really, really big problem. I'm glad that BlackCloak is leading the charge on this area beyond just data broker removal records. In fact, I mean, one of the big positives of BlackCloak is just all the stuff that we're doing on the privacy side. But the threat intelligence team just this past year, right, released that in 2025, 1 out of 10, it's actually over 1 out of 10. So over 10% of our clients' personal computers that are in the healthcare, biomedical, pharmaceutical industry had malware on them. Right, we're not talking about a simple, right, pup or potentially exposed or unwanted program that's on the computer. We're talking about actual malware on there that's harvesting the information, putting the kids at risk, putting the family members at risk, putting that executive at risk. Quite honestly, putting the entire information security program of the hospital perhaps at risk as well. So this is a really, really big problem. And once again, it's just something where there is no off, there is no, hey, work and personal life. They're just really, really combined. And so you got to have solutions that are combined as well.
You mentioned, some of the ways that those are remediated. DVR, not enough, but it's something, obviously, it's a part of the equation. Home network protection, another aspect of that full protection. But when we talk about truly being secure, it really does come down to that holistic protection, right? And can you explain, why the comprehensive concierge cybersecurity aspect of this is so vital to shrinking that attack surface for them?
Yeah, so I mean, BlackCloak is the company that started the category of digital executive protection, focused entirely on, right, the board members, the C-suite, the executive leadership team. That might be your top 10, might be your top 200, 300 executives at the company and their family members. When you think about that, and we just released in last June the Digital Executive Protection Framework. So first ever, right, framework out there. And it covers some 14 key tenets of digital executive protection. Now, I want to say, look, we BlackCloak don't do all of them. Right? There's a physical security element. There's a social media element. There's some things in there that we don't cover. What we want is every CSO and every CISO, right, going ahead and focusing on the strengths of their program, getting the general counsel, marketing, and all the rest of the different folks that are there, both physical and cybersecurity, to look at this together, to benchmark themselves as to what they have, and to go ahead and chart a course for how they're going to go ahead and reach the level of security that they want there for their executives. And it really comes down to 4 key areas, right? And the risks that we're trying to protect against are, financial risks, reputational risks, extortion, cyber security and cybercrime risks there, but also the privacy risks and all the rest. So when we think about that, we think about it in 4 distinct areas. First is going to be the privacy area of expertise. Once again, like data broker removal, this is just table stakes, but this is not sufficient anymore. Want to make sure that the deep web, dark web searches are going and running 24/7, that people are actually getting the right counsel and advice on their passwords, changing passwords, and putting in place encrypted password vaults, where it's one-to-one relationship between somebody on our concierge team and that family member to go ahead and implement better and more safe cybersecurity. Getting your homes removed from Google. I mean, this is once again, created by, owned by BlackCloak and some other different interesting technologies there as well. Making sure that you're protected against identity theft, making sure that when you're out and you scan a QR code that you are protected there as well. So really, if you had to say it, would be mitigating, shrinking that attack surface from a privacy perspective is all of what BlackCloak is doing for that executive and their family members. Some of it we do with them and for them. Some of it we're able to do through our product as well. The second area is going to be cybersecurity. And just, simply said, BlackCloak protects your personal cell phone, tablet, and computer. When something bad happens, it's us, our team, our technology that is going to be put into action. We have a 24/7, 365 security operations center run by some of the folks that are out there from most notable companies in this space. But all of this is in-house. And I want to stress that, right? This is all folks that are FTEs that are in the United States using our own software tools, technology to go ahead and effectuate a lot of that monitoring, reaction, and response. And what's really great is it includes things that are never been seen before. Deception. Every single one of our clients' computers, every one of their computers has a honeypot on it, a deception network on it that we built, we own, we operate. We had a few hundred hits last year, and every single one of those hits is a real hit, a real alert, because of the amount of traveling that they do and the networks that those family members and executives are on. But that has to encapsulate all of cybersecurity. Third is going to be the home. Look, the homes are living, breathing entities. The amount of Internet of Things devices that are there in the home, the amount that the kids are bringing into the home, even just their sophisticated smart home systems, Crestron, Savant, Control4, Lutron systems in the house, best of the best technology, right? Hasn't been set up correctly, hasn't been engineered correctly, does it allow cyber criminals in, has it been updated and patched? I mean, this is one of the simple things where if you have some good security on the inside of the home, but the front door is wide open, it doesn't matter what the rest is, right? It doesn't matter because you have access to everything. And so it's really, really important and incumbent upon us, and we built this technology. We scan the homes every 7 days. We try to break into our clients' homes every 7 days, and on average, Dan, they have 2 to 3 homes, these executives. So we're doing that, and here's the cool thing. We'll remediate it. This is not where an executive has to do more. They don't. We'll take care of it, our team. Which brings me to the concierge. The concierge is really, right, this strike force of privacy experts, identity theft experts, social media experts that can deal with, right, children, social media accounts, all the rest there. We even have experts that have testified before Congress on child exploitation. We have the team, the tools, the technology there, but more importantly, our team members have the humility, right? Our cloakers, as we call them, they have humbleness as one of their key, right, personality traits, to be able to sit there one-to-one. So there's no handoff to someone else. There's no, hey, here's a PDF, and just go ahead and do the steps on your own. Us and our team, right? If you're a CISO, if you're a CSO, and you're purchasing on behalf of the executives, you can rest assured that our team members are going to be helping your executives and their family members one-to-one. And we want to, right? That's a cool thing. We have the people who want to do that each and every day. When you bring those 4 things together, then you have holistic digital executive protection. If you don't have those items, you don't.
Yep. And that leads to that peace of mind that they know that they're protected and secure. And you spoke to the experts on the concierge team that are trained to deal with these circumstances. They're also able to effectively handle these at the most heightened states of tension for these individuals, right? There's a lot of anxiety around that, and these experts here are able to bring that calming effect and say and the confidence to it, right? Like, hey, these are the steps in place. This is how we're going to remediate this, and that really lends to that peace of mind.
Yeah, I mean, the Security Operations Center, the team, the people are second to none. These are just the most amazing people ever. Like I said, most humble people ever. They're experts in their area. They know what they're doing. They know how to do it. And they know and are specially trained how to do it with this population of individuals. And their goal is to make sure that everyone's delighted at the end of any session, at the end of any question. And that's what they live for. I love it. I'm super proud of them. And they've been, I mean, we had Inc.'s, Best Workplaces to Work award last year, which just, I mean, like, yeah, we've got those people. We had Inc.'s 5,000 fastest growing company last year, Deloitte's Fast 500 award last year. And we have several different cybersecurity awards for our concierge service. This is not a 1-800 number and it's just off on a side. These people are the front lines of BlackCloak. We are digital executive protection, and this team is unlike any other that I've ever worked at. It's just a privilege and a joy to work with them each and every day.
It's a fantastic team to work with. Couldn't have said it any better myself. And we have a lot more on BlackCloak.io as it relates to the healthcare sector. So go over there, check out the various resources, blogs, and podcast episodes as well. But Dr. Chris Pierson, thank you so much. It's been a pleasure.
Thank you, Dan. Appreciate it.
You can listen to all episodes of Uncloaked at blackcloak.io/podcasts. We're available on your platform of choice. And if you're interested in becoming a member or want to learn more about how you can protect your digital life, visit blackcloak.io. There you can request a demo and access research reports, insights on the latest cyber threats, and more. Thank you for tuning in, and we'll catch you next time on Uncloaked.